sign rolls.
Hey, let's just check in and see how
Oh,
we're
we
doing.
need to check in. How's everyone doing?
Let's go around the circle. Emily, how was your weekend?
My goodness, good.
Good?
No, yeah.
Great.
Quinn, how was your weekend?
It was good. I went with my life group, i.e. you guys, to Dana Point, and it was
No way.
awesome.
Wow.
And Anna came with, and she had a really good time too. And I feel
So-
energized and refreshed. The ocean air is incomparable for the health of my lungs. So, yeah,
Lovely.
now I'm back and ready to work.
Que bueno. Mary.
How was Mary's
My weekend was pretty good. I, no surprise, went to Dana Point as
No
well.
way.
No way.
No
Went to
way.
the ocean,
Oh.
had a great time.
The same part as Quinn and
Yeah,
as
actually
Leslie?
the very same exact part.
Oh, lovely.
I also had a great weekend. I also went to the beach with my life group here.
I'm so happy to hear
And it was
that.
fun.
How was your grandpa's birthday dinner?
Oh yeah. I had a fun family grandpa birthday dinner on Saturday night. It was really fun. Ate a lot of good food. So good. Yes.
Wow.
What did you do this weekend?
I also went to the beach. I did not go in the water because it's too cold. I stayed on the sand. And it was very fun.
That was cold water. It takes a lot of energy to be in cold water.
Yes.
Yeah.
I can't
Like-
believe you guys swam.
Yeah,
Wow.
I was
I
like,
always
about that,
very
and I was like,
enjoy
I'm
it.
I stuck one
exhausted.
toe in there and I couldn't.
I did enough as a kid. I'm like, I don't need to do it anymore.
Like, I'm fine.
Yeah.
I
Where'd you
also
go?
went to a Laguna Beach. I went to this park called Dana Point or something, and I played volleyball with people from my life group, and overall it was very fun. All right.
Josh, what did you do this weekend?
I recovered.
Wow, great checking, guys. Okay. I feel like I haven't been the leader in a long time, so I can be the leader.
Great.
Someone want to
Great.
be the scribe, please?
I can be the scribe.
Thank you, Josh. Timekeeper?
I'll be the
I'll-
timekeeper.
Great. And then everyone else is researchers.
Okay.
Okay.
Nice.
Yay.
Yay.
I can start by reading the first case. Mrs. Brown is a 50-year-old homeless woman who presents to the ED with progressive falling and exhaustion over the last 6 months. She also complains of recent tongue pain and of an electrical tingling sensation that zips from the back of her head and into both legs. She states that she had recently traveled to Riverside from San Francisco to visit Elvis, and she requested housing from the ED staff because she did not have a place to stay. She claims to have had no prior medical problems, but in her belongings there were bottles of metformin and omeprazole that were prescribed to her from an urgent care clinic in San Francisco.
So what time frame is this based on? Is Elvis still alive?
No.
No, Elvis is not
No.
alive.
I think it's
No, I think it's just.
I think she's-
delusion.
Yeah.
It sounds like delusion.
I think, yeah.
And she's homeless, so maybe some sort of psychotic disorder.
Yeah.
Well, like a neuropsych exam.
Oh yeah. Put behavior and neurologic for schema. I don't know.
Learning issues.
It's like environment. No, I don't think environmental maybe.
Could bottles of metformin and omeprazole?
Sure. She's probably diabetic.
Oh, so I guess you
So
could-
if she doesn't take that, could that cause some,
Hemoglobin.
what, like if you don't take your diabetes
Some type of
medication?
encephalopathy.
Can that come
And
in? Yeah,
glucose.
Yeah.
I'm gonna ask that question.
Nice, nice.
What if, there's gonna be what if question.
MRI.
What if you,
Always MRI.
Yeah, that's an antacid. Proton pump.
Oh, we could also do like a drug screen. Probably.
Yeah, that would be
She
good.
could also be like, could also be though, because of drugs.
Do we have any more questions? What is the?
Where do you put the? Oh, I see. I see.
I feel like. Do we want to save the MRI for later after we've done the neuro exam? Do we want to do it right off the bat?
Well, I mean, she's still.
Wasn't she like falling?
I don't know. Here's the thing. I don't know if we like there will be more options for tests we want to order because this is the first time that it said something like this.
Got it.
You know, so we might as well, especially since she's
Like
having
student.
delusions.
And I guess that's a good order, like that we've put it in.
Yeah.
That you would do the MRI last after,
Yeah.
like localizing everything.
That was pretty good.
See, what about like ketones and stuff? If she is diabetic and she has like
Keto.
like
you
urine
want
test.
I
Do
feel like she would
like,
be presenting with more symptoms if she was.
Doesn't a drug screen come with urine?
But also,
But like specifically.
ketoacidosis is more like type 1 than type
Oh, I
2.
forget.
Yeah.
Yeah.
Well,
Yeah,
what if
Well,
is it?
metformin's more for type 2,
Yeah.
but like,
Do we know if she's type 1 or something?
Well,
No.
if she was type 1, she would probably be dead because she is not
That's
taking
true.
insulin.
That's true.
Mhm.
That is true.
okay. I mean, this was pretty good for now. If you want to do one more learning issue for now,
Yeah, I might want to put it.
let's do
Question.
one more. How about?
And
Why don't we just ask the question about type 1 versus type 2? Like, how would they present differently, right?
Or what are the different treatments?
Yeah, or
How did you treat this?
yeah.
What type?
Oh, that's type 2. And the mecrozole is for GERD.
2.
It's PP.
Ah.
PPI. Okay.
Okay, that's good.
Oh, degenerative maybe, also?
Yeah,
Yeah,
that could be good. Yeah.
maybe schizophrenia?
Mm-hmm.
And so that would also be developmental there?
That you should. Yeah, then I'll write that. That's good.
It's not on this little
developmental
box.
though?
Well, what if she
Oh
was
yeah,
born
it's
with
not
it?
in there.
And what
Well,
if
that
it
would
was?
be no. It's congenital developmental. But
Oh,
I
that
don't.
one.
Oh.
But she's also like.
How old is
50.
she? Oh, 50.
Yeah. So I feel like there would have been. I don't think it's congenital or developmental.
No, I mean, it's just because I'm thinking about schizophrenia, which there's evidence of it both being a developmental disease and a degenerative disease.
And environmental.
And
Environmental.
yeah, so it's like,
And genetic. And
like regardless of when it presents.
I think that's good. I think you should include it.
Thank you.
All right.
Oh,
I can. Whenever you guys are ready, I can read part 2.
Should we move on? Yes. Go, Alan.
Okay. You want me to read the values? Okay. Physical examination.
oh, sorry.
Temperature 99 degrees Fahrenheit, 150 over 90 blood pressure, 92 beats per minute, heart rate, respiratory rate 14 breaths per minute, 100% O2 sat. She weighs 85 kilos. She's 60 inches tall and she has a BMI of 29. General appearance, labile affect with rapid and tangential speech, or HEENT, respiratory, cardiovascular. All the abdomen, skin is normal, cranial nerves 2 through 12 intact, normal strength throughout, reflexes 2+ throughout, but she has absent Achilles reflexes bilaterally. She couldn't feel the vibrating tuning fork at the toes or ankles. She has no ataxia with finger to nose or heel to shin testing. Her walking is mildly unsteady. She is unable to stand with her eyes closed. Mrs. Brown is discharged from the emergency department and referred to a local homeless shelter. Okay, guys.
Quickly, no, they didn't
Wow,
do
you-
anything?
Yeah, okay.
Thanks a lot.
Is there anything else we would want to order?
Now you guys are fast. Alright.
What,
Nice.
what additional information would you like to order?
Oh, we already did the MRI.
Yeah.
Maybe
We could put the MRI on this part and get rid of it in the first part.
Yeah, we could do that.
Yeah. Okay, I'll delete it.
does
Because it still seems like it could be like diabetic complications.
Oh, definitely. Yeah.
So,
Mhm. Yeah, it could be, yeah.
peripheral
Peripheral
What is the
Achilles?
HENT?
head, ears,
Oh,
eyes,
okay.
nose, throat,
And if she's not able to stay there with her eyes closed, that's even.
Romberg.
Yeah,
that's like
The
proprioceptive.
proprioception.
Yeah, so
Or-
loss of vibration, proprioception.
Okay.
and that's dorsal columns pathway, right?
Mm-hmm.
Does perineoplastic cerebellar degeneration have anything to do with that? I think that's more because she didn't have any ataxia, right?
Yeah.
Yeah,
No
that's
ataxia,
what
yeah. So I don't
think-
think no.
yeah.
Okay.
Yeah.
And she's kind of like too old to be presenting with.
Is it bad that we don't have more learning issues?
No, we're just we've been studying a lot.
You're right, you're so right. So true, bestie. Moving on.
Moving on.
I can read it. 10
like
hours
diabetic
after
neuropathy.
discharge, she returns to the hospital after another fall. On her return, she also reports that she has been unable to find Buckingham Palace, and she feared the palace staff would send her to Mars with her twin brothers Jeff and Elon.
Jeff Bezos and Elon
The
Musk.
results of the physical exam remained essentially the same. She appears disheveled, unkempt, malodorous, and knows her name and time of day. She has inconsistent thinking and delusions of persecution. A more detailed psyche eval reveals she names the city and state as Linda Carter and Argentina, respectively. She is alert and responsive during the interview. She is able to recall 2 of 5 objects after 5 minutes and is not able to subtract several serial 7s into repeat phrases. Her Montreal Cognitive Assessment measure is 20, normal 26 to 30. She maintains eye contact and has no abnormal movements. Her speech has malapropisms with mispronounced words and is pressured. She appears happy with congruent effect. Her thought processes are again tangential and disorganized. Repeat neuroexams unchanged.
All right. Well, I want to know what malapropisms are.
Ooh, that's a learning issue.
Yeah, learning
What?
issue.
Have we learned anything about the Montreal Cognitive?
Just that it's a thing, really. Like,
You draw the clock and
it's like
Oh,
that
yeah, yeah, the
picture
clock,
with
yeah,
like
that-
the animals
yeah.
and like whatever.
Oh,
What
you're
she
talking about the mocha.
yeah.
Yes.
Yes.
The mistaken use of a word in place of a similar sounding one.
Is that like,
For instance,
What?
dance a flamingo instead of dance.
that's
A
the
flamenco.
word
Huh?
use
Oh,
area?
Wernicke's area.
Wernicke's and stuff.
Was she
Uh,
an alcoholic?
Well, she's got a working memory problem because she can't do the subtraction.
Is that
Not
a
able to subtract
calcula?
serial sevens.
A calcula?
Not
Yeah,
able to
so-
subtract 07s and to repeat phrases.
Yeah, so
Oh, she's
that's
not
the,
able to
that's
do
the
it.
working memory and the it's not semantic memory. It's the working memory that she has an issue with.
Use of words in the wrong context, often in place of.
Returns to the hospital 10 minutes after she was discharged.
10 hours.
Oh, is that 10 hours?
10
Oh, I
hours.
thought
not 10
that's
minutes.
a 10 minutes. Oh my gosh.
10
I was
minutes would
like
be-
hallucinating too.
The thing is, I don't think what additional information tests would report. I feel like the biggest thing is the MRI, but we already
I
said
don't
that
really
we
really
want
need that
that.
MRI.
Mm. Is there any other like cognitive tests?
Well, now she's had like a thorough psych eval,
Yeah,
and
yeah.
like her neuro exam is still the same. I don't know. Like if we already ordered like a drug test, like I don't think blood work would really show us that much more. Or I
Like,
guess
do we need to know or any
thiamine
like
level,
kind of,
maybe.
yeah, that's what I was. Yeah, I was like, what could cause what are other causes? I
Okay,
guess.
thiamine test, just
Is
in
that
case it's
causes the-
Wernicke's or Korsakoff's.
Yeah.
Wow, did you go to class this morning or something?
Actually, I didn't.
Oh, how did you know
Is
that?
that an election?
It's in the lecture notes. I reviewed the
It's in the
lecture.
lecture
notes.
Let me just clarify for the
Clarify.
video.
Good job.
So thiamine tests.
So we're already asking for a scan, right?
Yeah, we already asked for a scan.
Because how much of this would be like dementia type symptoms? I realize she's not that old.
I feel like it's more
I
Probably
think,
likely
not.
to be like because of some like more like due to a medical or I guess.
yeah, or like faster degeneration.
Well, I think
like
this,
Like,
sorry.
oh, you go.
unable to recall stuff, not able to subtract or repeat phrases, that's,
That's like the
I mean, it could
working
be
memory.
working
that
memory,
is
but
the
then,
working memory.
but unable to do it after 5 minutes, I think that's more, that's anterograde amnesia,
Mhm.
which suggests degeneration of the medial temporal lobe. And so maybe, is it just like further degeneration of like underlying schizophrenia, or
Maybe
is it
so
like
we could
new onset, like
Yeah.
That could be a lot of things.
Alzheimer's? Yeah.
That's something
I just did
just
that.
doesn't see
I remember
how
asking you guys
you're
yesterday and
supposed to-
studying them all this morning.
Well, I
Yeah.
just think like
Well, unable to repeat
I just
phrases
don't-
is a little
I
bit.
think we could possibly put Alzheimer's as like,
Like
is
a
that a
differential.
diagnosis? But I want to put it at the top just because of her age. Like,
Right.
Yeah.
Because I guess we'll see like once.
Yeah.
But I think thiamine because we don't know her alcohol use or anything like that, and she's homeless.
And like the delusions
Yeah.
too is not as
is
much
not as much
Alzheimer's.
Alzheimer's.
I
Yeah.
think.
Yeah.
No,
I think
it's
that's
not.
what
It's
we're
not
doing.
as
Yeah,
much
it's not as
Alzheimer's.
much.
I feel like what I want to
It
see at
seems
this
like
point
a
is just,
combination of like Alzheimer's, schizophrenia, and diabetic
Yeah.
neuropathy, like,
yeah.
Yeah.
which could all co-occur.
Mhm.
Okay. I guess.
Especially if you're not like.
Maybe she had a long period of untreated schizophrenia, right?
Do
What
we
is
want
that abbreviation?
like the
Duration of untreated
Oh.
psychotic symptoms, DUP.
Yeah.
She had a long dup.
Thank you. Do we want to go to
The next one?
next one?
Yeah.
Yeah, part four.
Who wants to read it?
I can read part four. That's where we're on, right? Okay. Urine screening is negative for amphetamines, barbiturates, benzodiazepines, cannabinoids, cocaine, opiates. I don't even know how to say that
Put all of
word.
them on there.
Yeah.
PCP.
Yeah, PCP. And serum screening is negative for salicylates and okay, that and methanol, and antidepressants. Urine pregnancy is negative. X-ray of the right hand and wrist showed no acute fracture, dislocation, or soft tissue abnormality.
Wait, why are they getting a right hand x-ray?
'Cause she
From
fell.
the fall?
Yeah.
Well,
Yeah.
The joint spaces were preserved and there were no
I guess it's
joint erosions. It probably should have.
X-ray.
Yeah.
They fell.
But they didn't say like, she didn't say anything about her wrist or
That's
anything.
true.
Yeah.
They didn't even say
Oh, yeah,
like
that's
a
true.
right or left.
Sorry, negative for that. I thought I said positive. I was like,
No.
dang.
Pregnancy?
For all of those drugs. I was like, oh my goodness.
Okay. Miss Brown reported
It's a
no
dual
past
offender.
medical history. She said that she had previously been a volunteer patient at a psychiatric clinic in San Francisco. Review of systems is negative for trauma, appetite change, weight loss, weakness, feeding, headache, dizziness, seizure, fainting spells, pain, adenomia, expansive mood, distractibility, anxiety, memory difficulty, sleep problems, auditory visual hallucinations, and suicidal and homicidal ideation. Her social history reveals that she was born in Florida and grew up in the foster care system. She had skipped multiple grades because her IQ is higher than Ben Franklin and had obtained doctoral degrees in psychology from Harvard University in Argentina and Rutgers University in Russia. 5 years earlier, she had moved to San Francisco where she camped outdoors. She was employed as an astrophysicist and performed internet research and volunteered at various libraries and schools, including UC Berkeley and UCSF. She was previously married to Howard Hughes and had no children.
Oh,
And she had no
so it's
family
like-
who could collaborate
Ah.
her corroborate. Her reports, she denies alcohol, tobacco, and illicit drug use. Her family history is unknown. She has no Mr.
Do you remember if you need,
I think that's like all of her social history. I think you could call it confabulations, where it's like they're
Yeah.
generating so it's generating false memories without intention of deceit, which I don't know what else you would
Delusional.
qualify that as, because it's not.
I mean, she seems pretty delusional.
so,
Yeah.
but does delusions
Why
always
is
have
this
an
one
air of
first
like being
off?
persecuted?
But it's like confabulations, do they have to be like that abstract kind of, or like are they like like how false are the memories? Like, cause those are kind of like
Confabulations, everything is a lie.
okay.
But like all of what she's saying, nothing about it makes sense.
Delusion?
Yeah.
Because I don't think we can say
That should be a learning issue.
Yeah.
What are the differences between
delusions
delusion
versus
and
confabulation.
That's a good one. Good one.
That's a good one.
Or schizophrenia.
Delusion is a false belief, and a confabulation is a false memory.
Which I would think that it's
A bit of both.
a bit of both,
I
but
feel
more
like it's
memories,
more-
because she's like saying this is all of her like
Like,
life.
Instead of like everyone's
Instead
This
of,
has to do in the
this is what I
past.
believe.
Yeah, this is
Instead
all
of
the stuff.
Yeah,
It sounds more
exactly.
like
What
a
did it say?
confabulation.
Yeah.
Delusion is conviction, and
Yeah.
she's not like
Delusion is like things are happening to
But I
me.
thought confabulation was supposed to make more sense. Like,
Yeah, that's
you're
what I was
really just
thinking.
trying hard to fill in the gaps of what think you're supposed to know.
Well,
I
I
thought it was
think
like,
she-
oh, I thought you were my son kind of thing. Or like,
I
thought
think
that
she
I was born in
is.
this city.
Claiming
don't
relation
know.
to celebrities or like degrees
I
from
don't
these really
know.
prestigious.
Well, I think
fake
that's what she's doing.
universities.
Like she's like saying that she has degrees and like she's very smart.
But, like,
and
in part
employed
I
as
don't know.
an
It just seems like an
astrophysicist.
overstep, but
Yeah, but because like in part one, she said that she recently traveled, to visit Elvis. So like, is that like a confabulation or is that like delusion?
because I feel like most people, even if I don't remember what's going on, I'm not going to claim to have gone to see Elvis. Like, I don't know.
Yeah, I don't know.
Like, there would be enough mental faculty left to know that that's not appropriate.
With confabulations, you're saying?
Yeah.
But let's research it because.
But you can. I think you can.
Who's researching that?
Yeah,
I'm trying to find some stuff.
maybe they're.
I think she can have both.
Yeah, I
because
think so.
I don't think delusions really apply to like what her social history. They more
Mhm.
apply to like what she said that she was doing before she came to the hospital.
Yeah.
But I don't think delusions really like applies to the social history aspect of it. I don't know.
How'd you get to Google Scholar again?
Oh, just
Scholar.google.com.
yeah, I just type Google Scholar.
Okay.
You can just, you could have just hit enter at some point in there. Yeah.
It's like you old people.
I don't know if do we want to order anything else? Like we have a drug screen, we did the thiamine, we did the MRI. I don't know what else you can order, like psych-wise.
Cobalamin.
Sounds kind of like.
Cobalamin?
Yeah.
Okay, throw that in there, Josh.
Maybe does the foster system keep health
Adverse
records?
childhood experiences, ACEs.
Like, does she have a file with the foster care system that might be useful to look through?
Yeah.
Do we want, I don't think we can put that as a learning issue though, because I don't think we can actually answer that.
Was there some
No,
like
everything-
childhood trauma
Everything for foster care, you need to have it like meticulously recorded, like if you ever go to the doctor for anything. So she should have,
if it's true?
But it's also weird, so to get in.
yeah,
I think it's also very hard
and
to
if
get.
she's 50, who knows if any of that is
Yeah.
online.
Yeah, for like 40 years, yeah.
Hmm.
The fact that she had previously been a volunteer patient at a psychiatric clinic kind of points towards a psychiatric.
But was she though?
Yeah, how do we know any of this?
How do we know this is true? How do we know?
Oh wait, she said. Oh, I
Yeah,
didn't see that
yeah,
part.
yeah,
I didn't
yeah.
see that part. I thought they said they. Okay, never mind.
Now I
No, 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 never mind,
understand
never mind.
Dr. House when he's like, everyone is lying.
Man, it's hard.
I mean, that's like
Yeah,
the
that's
most believable, like, anything she said,
Yeah.
so.
Yeah, that is the most. Yeah.
Maybe that's what she
Maybe it's
remembers,
true.
and then everything, I don't know.
Do we want to move to the next
Yeah.
part? Oh, did you erase the B12?
Yeah, I just added B1, B6, and B12 screening to the one B4.
I
Oh, to
looked
the
ahead a
one
little
before.
bit. She probably has thiamine deficiency.
Yeah.
She has the
Wernicke
blood
Korsakoff
test.
syndrome.
Like
Oh, should we?
she has the hypersegmented neutrophils and the
Should we say
macrocytic anemia.
Oh.
Should we look for, have we done?
Is that thiamine?
Wait, no,
That's
that's
thiamine's B1,
no, that's
right?
B12.
That's
B12
B12.
is thiamine.
B12 is
B12 is thiamine.
Really?
No,
Yeah.
Wait.
no, that's
B12 is
B12 is
cobalamin.
cobalamin.
yeah. What are you guys saying?
I was like,
wait.
B1.
Thiamine is B6, isn't it?
B1.
No,
Oh, no,
B1,
B1.
B1.
Oh no, it's B1.
B6
It's
is
B1.
higher-
It's B1.
higher.
It's B1. It's yeah.
Oh right.
Yeah, it's
Yeah.
B1. It's B1.
Okay, part 5.
We can have multiple
Because
deficiencies.
of concern about Mrs. Brown's
You're too
ability to
ahead,
care
that's the
for
thing,
herself in a new setting, Alan, authorization for involuntary hospitalization is obtained. She is admitted to inpatient medical unit. Urinalysis and blood gas are normal. Lab results available on the 5th hospital day are shown in the table below. And she has a peripheral blood smear, which, what is that again? That's like the
Hypersegmented
Hypersegmented.
neutrophil.
neutrophils. So then she has a low hemoglobin, low hematocrit, low white cells, low neutrophils, high monocytes, high eosinophils, low red cell count.
Sounds like macrocytic anemia from
Yeah.
like B12 deficiency.
MCV is elevated. Yeah, it's looking like macrocytic.
Yeah.
The creatine kinase is elevated, lactate dehydrogenase elevated, and prolactin is elevated.
Oh, prolactin's elevated. What is that?
Prolactinemia.
Where's that from? She on any antipsychotics? Risperidone, possibly?
Oh my gosh, dude.
Maybe she's. Is
Sorry.
she taking any medication?
Sorry, that was.
What do we know? She's not on any.
I can't assume these things. Could she have NMS? Creatine kinase is up. She's having delusions. Does she have a fever? No, she's 99. She's good.
Okay. Based on what you know up to this point. So we're still putting the same schema, but we're just adding immunologic.
Yeah.
What were we saying with the macrocytic anemia is having?
B12 deficiency and folate deficiency.
And there's also,
I think
it's another thing I forgot.
because the next thing is differential diagnoses, so I guess B12 deficiency should probably be number 1.
Yeah.
And then probably Wernicke-Korsakoff syndrome, number 2.
Oh, I think it's just called Korsakoff, right?
Well, it's like, it's a,
Discount.
because there's Wernicke's and there's Korsakoff's, and then you can have overlaps.
I thought Korsakoff's was like next stage where
Yeah,
Somebody
it
made
is.
it sound like a lecture.
Okay.
Damn.
No one else is
Someone tried to
bothered.
steal a library book.
Scary.
No, it's because they often like happen together. That's what it
Mhm.
says.
okay, I see.
So.
Yeah.
Oh, but you
um,
can also have.
Do we also want to include like a diabetic
Can it cause central symptoms?
central? Which one?
Diabetic. Because like it sounds like she has
Oh, yeah,
diabetic
diabetic.
peripheral neuropathy. neuropathy, but she
Yeah.
has a
Yeah.
lot more
What-
central
Yeah.
symptoms.
There's a couple of things going on.
Diabetes.
I mean, we can put it on there because like I think that definitely explains a couple things that are going on.
But it's not our top. I think
But
it could
that would just be like an incidental,
4.
Yeah, but
like 4 or 5.
Diabetic, peripheral.
neuropathy.
So what about the creatine kinase? So like, what's affecting your kidneys stuff, or like your muscles? I mean,
A lot. I mean, if you're dehydrated, it
Rhabdomyolysis.
can
Well,
mess up
alcohol.
your kidneys. Like,
could
that can.
So
that
alcohol
can be a
could
learning
cause it
point
too.
or learning issue.
and the prolactin. I'm kind of interested in that.
Oh, yeah.
I mean, probably not prolactin. No.
What about pernicious anemia?
Mm.
Isn't that from B12 deficiency?
it
Hmm?
causes it.
It causes
It
it.
causes it. Yeah.
That's
Yeah, that's another one that has macrocytic. And,
Do we want to have that as
I
our,
mean,
like,
she has a high relative lymphocyte count. Would that point towards an autoimmune?
Also, does it
Yeah, it would, right?
I would
Right.
think.
And with history and physical, for
oh,
that you
she has a
have
weakened
like
stomach line. That's why she's
the
taking the PPI.
imbalance, confusion. So I think that could be
Is that like
our
a tapeworm infection or something?
third one. I think
I don't know. That's just a
pernicious anemia is
symptom of
number 3,
pernicious
Josh.
anemia, having weakened stomach
I'm
lines. That's why
confused
she's
the
on the
difference
PPI.
between
Because
deficiency
So
and
far,
GI
just-
reflux.
Okay.
Pernicious
Stomach
anemia
ulcers.
is a cause of the B12.
Yeah.
So
Yeah, and that causes the B12 deficiency.
Are we
because-
gonna keep
Isn't
it
there a
separate?
stomach infection that causes it too? Or am I
There
mixing
There
it up
is.
with
if we
something?
can
Oh.
think of more things to fill
Yeah,
up
it's the treponeme or no.
No, it's the
Treponema
fish
pallidum.
one.
Oh, it's the fish.
It's
The
the fish one. The di-
diphyllobothrium.
Yeah, if it's a
whatever.
long name.
Yeah, that one.
something long.
Yes,
Diphyllo. Yeah, that one.
the
Yeah.
DL
She's
fish
got big
thing.
lats.
Yes.
Yellow one. Like there's a
Like
picture of it in my
latissimus
head.
dorsum.
Yeah, yeah, something like that.
Yeah,
Something
yeah.
like that. Yeah, yeah. That one.
Okay.
Oh, Alan, you were working on those learning issues. Is that what you were doing?
No, I was just giving you ideas, researching. Sorry.
Oh, you were giving us ideas. You don't want to talk about yourself.
I'm bad at typing. That's why I'm slow.
Okay.
Oh, would you like me to do one? I will.
Yeah.
More than willing.
Go ahead.
Amazing.
Throw one in
Thank you.
there. We needed one more diagnosis. We have B12, Korsakoff, pernicious anemia, diabetic peripheral neuropathy.
Were we gonna have schizophrenia anywhere in there?
Schizophrenia.
Oh.
I
I
mean,
mean, no, we kept talking about that. And
Might
we
as
kept
well.
forgetting.
either
Yeah,
that or like a
schizophrenia.
dementia, or I guess
Yeah.
just one of the broader ones.
Well,
Yeah.
wait, because she's not having any hallucinations at all.
Mm,
That's true.
And I was
Yeah.
and I was thinking about that and got distracted earlier, so it's like
Yeah,
Maybe
yes, I forgot about
really
it.
I feel like she's
onset
delusional but doesn't have
So is that
Alzheimer's.
more of an Alzheimer's?
So we could put Alzheimer's.
but it could be
dementia.
delusional disorder.
I think
Like aggravated, like, cause you can have, like you
Oh
have
yeah.
like Alzheimer's and like if you have diabetes.
so. Alzheimer's dementia.
You could say like, you can get like, you're more like at risk to be aggravated to have delusions and stuff.
Delusional disorder involves delusionals that aren't bizarre, having to do with things that could happen in real life.
I mean, if we
So
want to
it's
put that on
like-
there, I feel like we could combine some of, like, the top 3 we could condense down to 2.
mhm.
Because you can have Wernicke-Korsakoff due to B12 due to
Yeah.
pernicious anemia.
But
Yeah.
Wernicke-Korsakoff is more B1 than B12.
Yeah,
Oh, yeah,
it's more
yeah.
than B12 and
Yeah.
pernicious.
Sorry, I keep getting, yeah.
Yeah, yeah.
I know. It's
Well,
fine.
Yeah.
So we want to include schizophrenia as well. Do we have
I
enough?
don't know.
I feel like
I feel
like they don't wanna,
Alzheimer's
like-
dementia makes a little more sense than.
Because even just looking at the confabulations, it came up like that.
Yeah.
Does dementia present with like a that word
A
again?
calcula.
Yeah. Isn't- I think that's
Because
It
Well,
does when it
Wernicke's-
progresses, I think.
Oh,
for
okay.
Alzheimer's.
Yeah.
Because
But
it's
she's only
Alzheimer's
50,
just
so-
affect like the different cortical areas, because that sounds like
Yeah.
what's
Yeah.
messed
Because
up here.
she had the messed up working memory, so that's
Yeah.
more like Alzheimer's. So I feel
Yeah.
like
I
if
feel like that's fun.
I feel like these are.
Is there any area where like a stroke would cause any of this?
How long is it presented for? Like,
I
it wasn't
think
like a sudden
what,
onset,
No.
There's like a MCA stroke in the dominant hemisphere. Is that? Am I right?
That would cause. But you
There
can't
was,
cause
like,
primary
Jersey
brain
syndrome.
problems.
That would
But
cause
I
what?
only
That would
like
cause what?
we haven't
like,
fully knocked out
yeah,
Wernicke's
I
or
think-
anything like that.
I think there's too much other stuff going on for it to be a stroke.
Mhm.
Remember Gerstmann syndrome?
So I feel like what we have is good for
Okay.
this case, and then go to 10B.
Well, because remember at the beginning, she's like, this has been happening slowly over the last month.
Okay.
But can we
Gerstmann.
trust her?
Probably not a stroke.
that's-
Can we trust her?
In that case, it would be a tumor then.
Patient is a poor historian.
Yeah.
Yeah, I mean, if you had a stroke and it was big, she
said
wouldn't
it's
be
been
able
over
to
the last
function
6
or talk.
months.
Yeah.
Wait, guys, how do we explain the prolactin levels?
Yeah.
Is that
I was just
necessary, or
looking
is that just like from another deficiency in something?
Oh,
I mean, that
Dopamine.
Because I heard, like,
not-
vitamin
not
D
enough
deficiency
dopamine in that
can affect-
pathway.
yeah. Yeah, that could explain it.
The tubular.
Because her thyroid is good,
infundibular.
right?
Mhm.
Yeah.
Did we check the? Wait, is there a thyroid test
I
here?
think they had that as one of their tests. Maybe.
So it's not like
Is it in
hypothyroidism
that
or like
thing?
Somewhere.
or some other thyroid.
No,
condition.
it's not in. It's not in the blood test.
Oh, there isn't a
So we
thyroid
could
test.
ask
We could
for
order it.
yeah TSH and T4.
Mhm.
Mhm.
Okay.
She's not.
No.
She's not pregnant. Nancy stopped 2 years ago. Okay. Done with this case.
Oh, do we need to sign up for mini illness scripts?
So. Yeah.
Where are these now?
Up to you.
This is for next time, right?
Yeah.
Okay.
Then we need to make sure to do the problems.
Is that as this time or next time?
Next time.
Okay.
Okay.
Who
so-
wants to do diabetic peripheral neuropathy?
Because we still have 5 more for the next case too.
Oh, that's what
We have 5 more.
Yeah,
what?
there's other
We
ones.
have the
Yeah.
other case too, so.
Alright.
We do.
Okay. Case 10B.
I did 2 last time
Me
too.
I mean, I think if you, okay.
Yeah, I think we're always gonna have, like, some people are just.
Yeah.
I'll volunteer to
Like,
do
if
1
we
this
can,
time.
rotate
I'll volunteer to
whatever.
do 2.
Yeah, I'll do 2 this time.
Maybe I'll do
I
3.
don't think I did 2 last time.
Okay.
Okay.
What's this magic ink thing? This is so weird.
Oh my gosh.
It's like, if you send
Josh
Just
is
like, hi,
You don't know.
you hold this invisible ink. Have you ever seen
Whoa, no, I had no idea that was there.
You're gonna start
It's like
sending
not-
everything
these?
with
Happy
like,
birthday!
happy
I
Send
kinda
with
like it.
confetti.
Oh,
Wait,
okay.
what is that?
Or
Wait,
it's like
what, guys?
invisible ink.
This is-
gentle.
If you press down the,
Yeah.
Send with a slam.
Oh, you hold the send button.
yeah.
Nice, okay.
Well, Quinn learned something today.
We're a couple of years, like 5 years behind, but it's okay.
You guys check it out, check it out,
Oh god.
check it out.
Everything's gonna be invisible ink.
Or like,
You can make Omni cards like that.
oh my gosh, okay. Case B, Quinn, can you read part 1?
Yeah, let me get over there. You are asked to admit. What, Aaron? You are asked to admit Mr. Eng in bed number 3 in the emergency department. Mr. Eng is a 56-year-old Asian man who was brought to the ED from a homeless encampment for altered level of consciousness and suspected seizures. Anti-epileptic drugs were administered en route to the ED with resolution of seizures upon arrival. Paramedics report to you that Mr. Eng's friends at the encampment told them that Mr. Eng has lived there for years. He occasionally drinks but does not consume tobacco products or other illicit drugs. He appeared normal until about 24 hours ago when he looked more tired than normal.
Okay.
So it's kind of like,
Sleepy Mr.
seems
Eng.
sudden onset a bit more.
Yeah.
Like, it's not like a progressive thing necessarily.
So it says suspected seizures, but then they administer anti-epileptic drugs with resolution of seizures. So doesn't that mean there are seizures?
Oh yeah.
Well, he was brought to the
Like,
ED
Or
for
suspected.
suspected seizures,
I know,
and I
the
guess they found out.
resolution.
But
I know, yeah, wait,
so
so
there
on the way
are
was
maybe there
seizures.
was.
I guess they found, they suspected it, he went to the
They
ED,
suspected it.
they figured out he had
It happened.
seizures, and they gave him
And it resolved.
antiepileptics. And it's resolved now.
Okay.
I was also, yeah,
Yeah,
as you're reading, I was like, huh.
I think we could do drug tox screen, maybe EEG. I don't know. No.
Oh, I don't know.
Oh, EEG, yeah.
Mhm.
Let's do an EEG.
What is that?
It's like brain.
brain.
In case he is having, if he is having
Oh,
seizures.
yeah.
Electroencephalogram.
Oh, that one.
Yeah. Neurologic, I guess. I don't know what other schema. Neurologic. Degenerative.
I know.
I don't know if we know
Benzos.
enough to say that it's degenerative.
Benzos, Emily.
I mean, we just don't know.
Well,
Oh,
I am-
neurological.
Lorazepam.
That's
Oh.
neurologic.
We can add
I got you.
No, I don't want to know this.
We're on the same wavelength here, Jen.
Could we
Is it fast enough to be vascular?
Oh, phenytoin.
Like he seemed more tired, but then it was like suddenly he's having seizures and level altered consciousness. So
Is
maybe
that used acutely?
maybe
So-
it's a stroke.
Which one?
PCA
Phenytoin?
stroke in the youngest.
Stroke.
We don't want to rule, you know, we gotta rule things out. So.
Stroke.
Do you have a stroke?
Idiopathic.
Possibly.
Toxic
Seems
environmental.
idiopathic.
Oh,
He
toxic
lives there and he's
environmental.
homeless and he's lived there for
Yeah.
years too. I don't know.
Infectious.
Well, I don't know. Oh yeah.
I think,
Could
yeah,
be.
yeah.
Yeah, it could be.
Could be
like
any of
acute.
these.
Could be
anything.
Neurodegenerative.
Well, we
Metabolic.
put neurologic.
Neurologic.
Yeah.
I don't want to say degenerative.
Yeah.
Yeah, that's a bit
It's
That's
serious.
kind of a stretch.
A bit-
Metabolic.
Could be.
Could
Could be. We don't know.
Neoplastic.
Oh, could be.
Oh, dang. Congenital? Sorry.
Well, maybe not congenital.
Sorry, probably not.
Let's
Probably
just
not.
say-
Probably not.
Do we have any more
I think that's
learning
it.
issues? I feel
What
like
did we
Oh.
say?
like
Learning
what
issues.
antiepileptics are used by EMTs.
I
I
just,
think that's a
Sort of
good
learning
one.
some
I
stuff.
don't think
Yeah.
we
it's
could,
just like-
you
Sorry.
don't know that much more.
Mhm.
You know,
you say benzos.
benzos.
Yeah,
What about benzos?
they can be used for seizures.
Yeah, but are they commonly used by EMTs? Do you know? That's the question.
And what would be like fast acting?
I don't know. Not an EMT.
Well, benzos are fast.
That's why you like things.
Yeah, they are really fast acting.
But do they resolve?
Yeah.
I guess.
I don't know, that article suggested those two,
Okay.
or that abstract.
On your physical
Yeah,
exam,
that's an old article.
you discover the following findings:
I just knew that. Emily.
vital signs, temperature 100.1. The pulse is 100, respiratory rate is 20, BP is 120/85. Is the rest of this normal?
Not the lungs.
Dentition is poor.
Well, I guess that makes sense.
Short of breath,
With an intermittent cough.
decreased breath sounds. Okay. Abdomen's normal. Skin looks. He's got a big lymph node.
He's got
He
two.
does.
2 big lymph
Seem-
nodes.
Neoplastic.
Infection.
Chest.
Does he have
Multiple
tuberculosis?
insect bites.
Ooh, multiple insect
Oh.
bites in the lower extremity.
Head lice.
Oh,
Head
left upper,
lice.
pie in the sky.
Pie in the sky.
Oh.
Yeah, pie in the
Ooh.
sky, pie in the sky.
Oh,
That's
It's a
in the
horrible.
temporal lobe in Myers loop.
Myers loop.
Yeah.
Yeah.
Meyer lemon pie.
Sorry,
Yeah,
what is?
yeah.
I'm confused. What is pie in the sky?
That's a
It's-
visual loss wedge.
Oh, that's what you're
Oh,
talking
this is
about.
And
yeah.
contralateral.
Contralateral, yeah.
Yeah.
Oh, okay.
If it's both like, you know, this side or that side is temporal lobe, but then if it also involves down here, then it's parietal lobe.
Mm.
The wedge gets bigger.
Yeah.
Parietal.
Got you.
Yeah, parietal, temporal, and then if it's like the whole thing, like
Yeah.
little bit macular sparing, that's PCA stroke.
Yes.
Yeah.
So, how does this all come together?
That's a great question.
Well,
Because just
short of
seems
breath.
like there are like a lot of problems with, like, I don't know, just a lot of problems that probably come from him being homeless.
I know.
Like,
Alright, well, let's see what Sandman did on our loaves after.
Insect, like, I was like, oh, insect bites is actually, it's all like, I don't really know what
because I would
I mean,
say,
that
Infectious
just seems
stuff.
like
It's just
poor
like,
hygiene.
yeah.
Yeah.
because of that.
He's
Especially with
homeless,
the
right?
headlights.
and the
That's
headlights,
not, that's gonna cause
like, I don't think
anything.
that's just having to do
Yeah.
with his environment.
Yeah.
But the left upper, so I feel like the biggest things are his, what seems, he looks like he has pneumonia, and then
Mhm.
the
The right
brain
axillary.
lesion,
Yeah,
No,
it
it's
is.
interesting.
axillary.
In the temporal.
Is it possible to have like a
Axillary.
relation to the uncus with the seizure activity? Is that close enough geographically in the brain?
He hasn't said anything about it.
It's just that uncus is so. I mean, yeah, that's, I don't know. I don't know.
What was your question?
It's a
And then he
good, it's a
doesn't
good
have
question
any-
though.
He doesn't have any, like,
Oh, maybe that's a
ocular
learning issue.
motor.
Can
Does he?
seizures cause like visual?
Yeah, probably.
Can it, well, that kind of visual thing though, because usually it would cause the cranial nerve 3 palsy.
Yeah.
And half of them.
And he doesn't have that.
if that's like.
What else do we want? Oh, chest X-ray, probably,
Okay, yeah.
to confirm pneumonia. Should we get a MRI to see the reasoning for his?
Homonymous hemianopes yet?
Yeah.
Yes.
I want a TB skin test.
Oh.
That's reasonable.
Sure.
We can also look for the cratering on the
On the chest X-ray.
Yeah.
Lungs, yeah.
Save him some money, he's
good
homeless.
confirmation.
That's true, yeah. We're sponsoring him, I guess. We got it.
Well, if it's a primary TB, I don't think you'd have the nodules yet. So.
Oh,
Yeah,
sure,
it's
okay,
yeah,
so let's
still,
go.
but
I don't know. I don't think a skin test is that expensive, is it?
no.
He does have a brain mass or a brain something.
Oh, you're looking ahead, Emily.
Emily,
Sorry.
We're looking ahead.
Do we-
So good.
I thought we were
I guess
done.
another question. I guess, well, the only questions is like
Let's throw in
the lymph nodes,
neoplastic.
right?
Man, yeah.
Neoplastic.
Wait, Josh, were you looking up the lymph node or was that somebody else?
FNA lymph node biopsy.
I think it was,
Okay.
I don't think it was me.
Sorry, I wasn't, but I can.
So if it's left of the quarter, does that mean it's on the right side?
Mm-hmm.
Mm-hmm. Axillary is usually from breast cancer.
That's what I'm saying.
Or it could be an infection.
Are you? This is that it could be caused by seizures, but.
Yeah, mine does too.
Oh,
Yeah,
okay,
yeah. Well,
great.
yeah. My
Then you don't need me.
research says that seizures can cause homonymous
Hold
hemianopia.
on, no, it's the occipital lobe.
Do we put chest X-ray there?
Yeah. Oh, under
Maybe it's a brain abscess. It's an infection that's causing seizures.
TB can also cause axillary lymphadenopathy.
Yeah.
Wait, could that be a brain abscess?
Are you looking at the next page?
We're not the.
I thought Emily was. Wait. Oh, sorry. Emily is one ahead. Okay, I'm sorry. Just
No, it's
sorry.
okay.
Sorry, what are we still working on with the last section?
I think
Learning
we're almost done.
issues.
Yeah. Any other tests? If not, we can move on.
Yeah,
Mhm.
just the testing.
Yeah,
Just that we're good.
That was pretty good. Well, I mean, you do like a CVC if you want.
Okay. You
Or
review
not.
labs
Or
ordered
not. I mean,
by the ED team and find that his EKG, CBC, sedimentation rate, CRP, troponin, and BNP are normal. His blood alcohol levels are within normal limits. His urinalysis and urine drug screen are also negative. Given his clinical presentation, you order a head MRI, which is shown below, which is showing a right temporal brain lesion. Thank you, Emily. Yes, what the only learning what can cause
A right
how about what are we looking at?
a right temporal brain lesion.
But what's the lesion though?
Well, it could be
What's
many.
the lesion?
What causes the
It could be
lesion?
like a brain
That's
tumor,
what I
it could be
said.
a tumor, it could
What
be-
Oh.
causes the
Oh,
lesion?
good, Mary. Perfect. Lovely. Hope this guy's gonna make it.
What?
Hope he's gonna make it.
Sounds good.
What other tests do we want? It'd be nice to get a biopsy.
Yep. So how did they get that biopsy like so deep in there?
After the surgery.
Just do a little here.
It's crazy.
Sorry.
What other information or tests?
Order common serum markers for brain tumors.
It's a good question.
Could possibly also have encephalitis.
Encephalitis. Maybe he has.
The short answer is a lot, apparently. So I'm gonna say CRM brain cancer biomarker panel. Something like that.
Yeah, put that
Okay.
in.
We could also order
Okay.
oh sorry, just
I was like,
we could also order like blood work to see if there's HSV. I don't know if that's really a good
For herpes simplex virus.
yeah.
Yeah, we haven't done brain cancer
that's
this
not
year.
what it looks like.
Yeah.
I don't really know what it looks like on
Yeah, they're
the
having us
side.
look ahead so we can puzzle over this, and then when we have the lecture, it'll all come together. They're priming you for long-term potentiation.
They knew about this. They planned
Yeah.
this.
They did plan it.
I don't know this well enough to all these brains look the same. So like
What are you trying to do?
encephalopathy because the HSV affects the temporal lobes. The HSV
Oh, that's right.
Especially bilateral.
Yeah. Well, his isn't bilateral, but I'm just like
Probably cancer.
okay. Well, I'm just saying it's an
It's
option.
an option, thank you.
Jess is on my side.
Sorry,
That's all
Mary.
I
It's
know.
like,
Oh,
it's
no,
like a
it's
global
side.
movement, right? Like not like a mass.
Sorry. Sorry, Mary.
It's
But
an option.
You're right.
It's an
It's an
option.
option.
We gotta
I
rule
mean,
it
his
out.
ventricle is also probably going to cause him to have
Yeah, how do his ventricles look? Look at his.
hydrocephalus.
It looks like it's already blocking that lateral.
It already
ventricle right
is.
there.
Yeah.
Pressure.
Oh my goodness.
Increased
It has
Intracranial.
papilledema.
How was his blood pressure?
we don't know.
How did he not have the cushion?
He was normal.
reflex?
Oh wait,
It was normal. It was
Normal.
120.
Yeah.
Normal enough.
There's no cushion reflex.
Everybody.
Yeah.
Yeah. Yeah. Good thinking.
Yeah, so it can't be really high intracranial pressure.
Okay.
There's no baroreceptor
Yeah.
response.
Okay.
Okay.
Can you read that for?
Yes, sorry. Okay. Within 24 hours after admission, neurosurgery is consulted. and the brain lesion is completely excised, and histopathological examination, shown below, shows extensive necrosis, a high nuclear to cytoplasmic ratio, and fine nuclear chromatin. The mitotic rate is 14 mitoses per 10 high power fields in the resected specimen. The Ki-67 labeling index is 25%. Immunohistochemical stains are positive for NE markers, including chromogranin A, synoptophysin, and CD56. PET scan shows increased fludeoxyglucose uptake in the right axillary node. All right, guys.
Learning issues. What is
A lot of
all
learning.
that mean?
Yeah.
What is fludeoxy?
I don't. Yeah, that's a good one.
Right.
What is? You guys beat me to the questions. Never mind. I'm too slow. It's okay.
Haven't we already ordered a chest X-ray? Oh, was that the other person? Or was that this person? We did.
Oh, we did already.
Yeah, it was like the first one. We ordered just chest X-ray. The case is just behind compared to us.
So if the CD56 is lung cancer, is this just metastatic for that?
Yeah, I think so.
Oh no. Yeah.
Ki-67 labeling is an important indicator of tumor cell proliferation in glioma.
Oh.
Glioma.
What
Growth
does
of cell.
25% mean?
But it means that 25% of the cells were expressing Ki-67 antigen positive cells,
Is that
or
bad?
they were Ki-67 antigen positive. Going to this other thing over here.
I don't know, it looks like it can be used in other cancers.
Yeah, because I see it
Okay.
come up in like breast and GI and stuff, and then I had
Mm-hmm.
to specifically type Ki-67 brain cancer, and then glioma came up.
Okay.
Yeah, it's in a lot of stuff. So it's 25% high or low? Does that like indicate like how severe it is or something? Like advanced?
What?
Like the labeling index, like it's 25%, like, do we know if it's like a low number, a high number? What exactly does it mean?
Yeah, that's a good question too, but I'm trying to figure that out also.
Oh, less than 25 is low. More than 25 is high proliferation.
For what cancer type?
Let's see.
I don't know. I'm looking at an article that has 62 is low and 77 is high, which means that we are
Analysis.
quite low.
Should we?
I mean, that makes sense, right?
Yeah.
If it's metastatic.
Yeah.
So technically, there's one more section after this, but do we want to put small cell carcinoma of the lung as one of the
Yes.
Mhm.
Yeah,
number one?
Yeah.
yeah.
With metastasis to the brain.
Yeah, I don't know. Yeah. Oh, is that the healer wait, what's that called again? Consolidation or something. Sorry, I was looking ahead.
Is there any other
That's from TB.
diagnosis indicated by the path findings besides the small cell carcinoma? Or everything just kind of basically points to lung cancer?
I think everything points to it.
Okay.
Yeah.
Especially part 4.
Are we done with part 4?
Yeah.
Yeah, let's be done.
Okay. On the second day after neurosurgery, Mr. Ang becomes more alert and appears pleasant. After extubation, his respiratory rate remains increased and his cough becomes more pronounced. You order a chest x-ray with results as shown. On chest imaging, you notice that the hilum on the left lung appears much denser than the right lung. What were you saying, Ellen, about the hilar?
I was just trying to remember what it's associated with, but I don't remember it.
Hilar lymphadenopathy is called. Lung cancer.
Yeah, it's probably cancer.
Additional testing.
Rewind, FNA. According to Stat Pearls.
Is that just like a lung biopsy?
The gold standard for diagnosis of lymphadenopathy is tissue obtained by fine needle aspiration.
Right, we have to come up with multiple diagnoses now.
I feel like they gave us the diagnosis.
I feel like, yeah,
Yeah.
just give it to us.
Because everything is explained by.
I mean,
What type of lung
Small cell.
cancer did you say? Like small cell? No.
I
I
feel
thought
like,
that's
yeah,
what
Could
the
it be any
C56
other-
marker was.
yeah.
Do we just start saying primary brain tumor,
Yeah, like
other kind of
primary
lung
lung.
cancer?
Glioblastoma. I would say
Can we just
mesothelioma.
say lung cancer? Isn't that, I
No,
feel like that's so broad.
there's a lot of them.
Paraganglioma.
Yeah,
Yeah.
I like that
Yeah.
one.
why? Just
Check his
because it's
ears.
synaptophysin chromogranulin.
And because it's here.
Yeah.
Yeah, any other like
Why?
neuroendocrine like tumor.
Pankos tumor,
Okay.
Horner syndrome.
Did he have,
We don't know.
that would have been on the neuro exam.
Do we want to?
They did a bad job. They were medical.
That's number 5.
Fair.
Yeah, I mean, affects your lung.
How about
I feel like that's not a good.
as?
But I don't-
Just kidding.
I'm
You put
like,
something.
tuberculosis made sense at the beginning,
Mhm.
and it
Yeah.
doesn't make sense anymore. But I
Yeah.
don't know what else we can put.
Should we
Like,
put primary brain tumor for one of them?
What if?
What if it was the primary brain tumor metastasized
To the lungs. That can be diagnosis number 2.
Okay.
Yeah.
Which
What
kind
if
of
breast
tumors do
cancer that metastasized to the lungs and the brain?
He's a man.
Whoa.
So?
Yeah,
There-
man,
I
Yeah,
think-
hey.
cancer too.
Yeah, but I think there was
Yeah,
other
very.
signs like gynecomastia.
We're
or
aware
something.
too, alright?
Yeah, we have
to be
those
aware
issues as
too.
well.
Maybe he's just a little
I
bit
feel like
overweight.
there would have been
For the
other.
horses, not the zebras.
Yeah, I
That's
think there
problem.
would have been other indications. Like at that point, we should have gotten like a BRCA or HER2. Like,
Yeah,
we should have
I
looked for
mean-
that if
Yeah.
there was any indications of breast cancer.
We could. It's
Metastatic.
okay.
Oh, we need one more.
Oh, we need one more?
It could be like a regular lung cancer that's like metastatic from
From
the
the breast.
pleural effusion thing. Do you guys remember? Like how like if there are cancer cells in the pleural fluid and then you get lymph drainage?
Oh yeah.
I forgot what it's called though.
You're talking about like, dang, I forgot.
But it's most likely not even that because like I don't know. It's the histology thing shows like small cell carcinoma. So I don't know.
Let's go,
So,
let's go draw some fluid and check for the exudate stuff. Just kidding. Mesothelioma, let's put it on there. Maybe he was exposed to asbestos or something, I don't know.
Mesothelioma. Have you or a loved one been exposed to mesothelioma?
So you may be entitled to compensation. Call this 1-800 number.
I mean, do we know what he did? Oh, wait,
what if we just
he is
put
homeless, my bad.
What if we just
But if
put
he worked
Probably
before-
had a job at some point.
If he worked before, like, I don't know,
Pneumonia.
doing some kind of construction, like demolition services or something.
It would
You
have to be
never know.
demolition.
Could it be like silica or something
Yeah.
in there?
Yeah.
And what cancer does that cause again?
Oh.
That's beyond me.
I forgot. When you inhale the type, it's like,
Oh,
Know
I
what
know
I'm
what you're talking about.
Yeah,
Yeah,
Silicose.
Silicosis?
yeah, that thing.
But is that a
Silicosis is
metastatic
not-
cancer?
It's not
though?
That's
cancer.
not cancer.
Oh, like you
It's
guys
not.
just-
Well, it's
It's
I don't
just
know,
a
it's just
lung lesion.
some condition that's bad.
I think we should
Yes,
put
it is
pneumonia.
bad.
We're gonna have pneumonia and TB.
I mean,
Yeah.
what else?
Okay.
Sorry,
I don't know.
Well,
Oops.
mesothelioma.
Is there
You
any
may be
disease that's
entitled to
transmitted by lice?
compensation.
Oh yeah, she brought up a good point. The lice could have done it.
What disease is transmitted by lice?
Oh, the body lice. There's the body
But it
lice.
was
Quintana.
he only had.
I know,
Oh
we
wait,
only have.
but he just had insect bite. Lice don't bite like that, do they?
We
I
had
mean, if
lice.
it's an insect bite, we could think of that to be anything.
It could be body lice that bit his body.
Wasn't there some condition
Well,
in one of the micro
well-
lectures from like several blocks ago that was like
It's like body
People
lice or
with-
head lice, right?
people who are homeless tend to have body lice
Yeah,
of this
yeah.
type?
Yeah. And
Like,
it
was there
causes-
something they transmitted, or was it just the fact that they had the lice?
No, there was something else about it. It
Something
was
with
like
a Q. Because you
Quintana.
thought it was funny to imagine me
Bartonella
homeless and
syndrome.
not rich.
Bartonella.
Oh yeah, Bartonella.
No one was listening.
Endocarditis.
Yeah,
Endocarditis, yeah.
Endocarditis.
It
Let's
comes
check
off
her
our
heart.
Bartonella.
Yeah, but there's no indication of heart problems,
Yeah.
so I don't
We-
think we can do that.
Okay,
Quintana, wow, I forgot
Well,
about
we
that.
can look at her. Oh, we have a chest
Quintana.
X-ray.
If I
Okay,
saw it, I
We
would
can
remember
just put pneumonia, I guess, and then.
No, I
I
like the
feel like
Bartonella
pneumonia is probably
Quintana.
better than mesothelioma.
Because either way, we're gonna be
What's up with
down to 3
That's fine,
anyways,
that's fine.
and I
Yeah.
think we have our
Yeah.
top 3
Yeah, just
regardless.
it's fine.
Okay. Well, that's it. We can stop the recording.
How about
What about carcinoma?
Oh, I want to change it to miliary tuberculosis. Even
Yeah.
though